Now basically what I'm going to do is I'm going to go through some of the motions that I talked about a second ago, and I'll stop on each one of those and discuss that a little further. So obviously we're going into the supine. Now you notice how easy that was. Whenever we get into the full supine mode, I'll actually stop this. Okay, so I'm stopping it, and as you notice, I'm using just a nice little simple remote here. It's very easy, it's very basic. So, you know, the doctor doesn't always have to do this. Now, personally, I always like to be with the patient so that I can explain everything that the chair is doing on that first visit. But beyond that, keep in mind you can use that for a modifier. On your first visit, get a little higher payout because the doctor was one-on-one, and you also get that longer extension on the time because you're stopping in between. However, your basic CA or front desk girl or whomever, if you have an intern in the office, they can do this with ease because all it is you're setting the time, you're setting the amount of travel for the mechanical traction itself, and then of course, you know, turning it off and on. Now beyond that, you also have the capability of controlling the vibration and the heat with this. Now, insurance payout on the heat and cold therapy these days aren't very well, so you probably won't get paid on that, but it is also another insurance code that you could bill out potentially for this. Some areas may pay out where other areas don't. My personal area doesn't pay out for that any longer, but you know, it doesn't matter. It still has a capability, and the more important thing is it actually helps the patient. When you have a non-hot back, you know, we're looking more at a degenerative disc or degenerative facet joints, as well as more of a chronic low back condition. You know, the heat and vibration therapy is going to help to relax that patient before you actually do the adjustment. Now what we're going to do is we're actually going to look at some of the lateral flexion, and this is what I was talking about beforehand when I talked about stretching of the pelvic and lumbar stabilizers, the psoas muscles and the quadratus lumborum muscles. Now, as the legs are hanging over the top of this, obviously, that's where you can really see where, you know, if a patient was on the table, you can see that right quadratus lumborum really being stretched here. Now, one of the things that I'll do in my office is, when I first initially see a patient and put them on this before the adjustment, I'll just go through a general, let the chair itself do mechanical traction and then do the lateral flexion just to get some stretching and get some pressure off of that spine and those discs and the spinal cord. But after the adjustment, I'll actually use this in some of my cases with lumbar curves, as well as some scoliosis cases if they're in the right area and the right type. I'll actually use this as a curve corrector. So, you know, in this situation, I've stopped the device into the left lateral flexion, but now in this position, I can actually increase the amount of mechanical traction that I have on this patient. So I can really work the muscles and I can work the structure in order to reduce the amount of curvature that we have here and retrain that body. Now, it technically could be utilized as neuromuscular reeducation, which is another code. However, in my office, you know, this is really what I'm using after the adjustment in order to help stabilize what I just did with my adjustment.